And amid the Omicron variant surge, the question that everyone's been asking about, where is the booster jab? And now to the doctor who first identified Omicron variant, speaking exclusively to my colleague India Today's Sneha Mordani. Sneha, over to you.
Joining us now is Dr. Coetzee. Thank you so much for your time here. We want to understand from you today, since parallels are being drawn between India and South Africa and the manner in which Omicron has spread and also the trajectory of the pandemic when it comes to the fifth variant of concern. Dr. Coetzee, do tell us, in the last 3 weeks, ever since you all found out about Omicron, what has been happening in South Africa? How has the situation now changed as of today?
Good morning from South Africa.
Hello. Yes, Dr. Coetzee, you can go ahead.
Can I go ahead? Okay. So good morning from South Africa.
Yes, good morning, doctor.
We in South Africa, yesterday we had a higher number of patients testing positive. However, again, it seems as if we are in Gauteng, past our curve for now. The numbers are coming down. Maybe coming beginning of January, we might see a surge again when people come back from their Christmas leave and coming back to work in Gauteng. We are seeing a bit of an increase in numbers in KwaZulu-Natal because that's where our people mostly go and have holidays, as well as in the Western Cape. For now, again, the hospital admission rates are still of such a manner that we are not overburdened, and our ICUs are still not overburdened as well. Most of the patients in ICU is unvaccinated, and the majority of patients still have mild symptoms. As we have seen, this is now our fifth week, or from a clinical perspective that we are looking at this.
Yes. From what you just told me, do correct me if I'm wrong, are you suggesting that the hospitalizations also right now seem to have come down?
Our hospital admissions is more or less stable, you know. It is, let me just say to you that yesterday it was 663 patients across 660 facilities. And then the previous day as well, we didn't have high numbers. On the previous day, 105 people died, and yesterday 35. If you look at these stats. And again, our infectivity rate yesterday was 27.6%. So again, yes, it's a fast-spreading virus. We should never not acknowledge that. It's fast-spreading. And in the beginning, we also saw doubling nearly every second day of our numbers. And then at some stage, it sort of stabilized and didn't double anymore. That's one thing that we have observed. The second thing is, if we say mild cases, we're not saying that those patients don't need any treatment. We're just saying that you are mild. We don't need to admit you. You don't need oxygen. You don't need a lot of medication. And we are also asking our patients to, when they test positive, to go and see a healthcare worker to make sure that they are clinically stable and all right. And if necessary, giving either prednisone and an anti-inflammatory just to try to, as much as possible, reduce the inflammation so that they can get easier, better. We have seen those patients that right from the beginning got some medication, especially around the prednisone. You don't wait 5 or 6 days, you start it immediately. Their recovery rate is between 4 and 5 days maximum.
Okay, you know, a study from a lab in Hong Kong has suggested that because Omicron is, right now only affecting the bronchi tissue and not so much the lung tissue, and that's actually one of the reasons why the infection isn't very severe, but it is more transmissible. Do you have any studies or in South Africa, given that the variant was first detected in South Africa and Botswana, to suggest anything of this nature? And is there any peer-reviewed data? Because I know that the WHO has already said there isn't much data which is available just yet on the severity of the infection.
So so two questions. So the first one regarding Omicron first detected in South Africa. So yes, it's true. It was detected in South Africa and Malawi. But when Europe, especially in the Netherlands, went back and looked at their PCR samples, it was already in Europe, in the Netherlands.
Sure.
A week before it was discovered or being recognized in South Africa and Malawi. So for now, it seems as if Omicron actually started in Europe. So that's the first one. The second one is, yes, it is predominantly a disease that attack the upper respiratory tract and not so much the lung itself. But I have seen a pneumonia, COVID pneumonia case yesterday.
Okay.
And so you should not think that you can't get pneumonia. You can. This specific patient, severely overweight, high blood pressure and diabetes patient. So you still have your patients that you need to monitor and make sure that they don't get severe disease. But the studies, what we are seeing, again, the majority of people's got mild disease. And I think I have already said that, so that, but it's important that people still go and get tested and go and see a healthcare worker.
So you are saying clearly do not dismiss this as a mild infection of the upper respiratory tract.
That's what we are seeing. We see a mild. So in the majority of cases, it's mild. But you will always. So this is the thing with a virus. You can never underestimate any viral infection. Okay, so if you are suspectable, let's say you're not, especially if you're not vaccinated, you're an older person with a lot of diseases and severely overweight, you might have a problem with Omicron. And therefore, we keep on saying, please get vaccinated. And people who can go for boosters should get their boosters. You should target your population. You should target the vulnerable people, the older people, and people with immune-compromised disease.
Yes.
To get a booster shot so that you can try to get them out of hospital. For now, what we have seen in South Africa, the boosters still protect you, not the boosters, the vaccines, because we haven't started with boosters yet. The vaccines still protect you against severe disease. As I've said, the majority of people in the ICU or high care are unvaccinated people.
Yes, Dr. Coetzee, I'll talk about boosters and the need to vaccinate and do so completely in just a bit from now. But just coming back to what you're seeing in your patients, because we are also bracing for a surge. There are projections in India that there will be close to 2 lakh cases in the month of February or so. And there is going to be a sharp decline like we're seeing in South Africa, for example. I want to ask you, of all the patients that you've seen in so many days and weeks, you do say that most of them have mild infection. The ones who are getting quite sick, who are developing pneumonia or some sort of lung infection, courtesy Omicron, are the ones who are unvaccinated? Are they vaccinated, or they are vaccinated but with comorbidities? By and large, what's your understanding of the situation?
So again, if I look at at primary health care, out of more than 100 patients that I have now personally treated, I had one person who got pneumonia, and this person did test at the lab. They did the PCR. The lab didn't alert any of us that this patient is positive. He felt great. He didn't feel sick. And that was on the 12th of February, December. And he only came here yesterday with shortness of breath. And I then made the diagnosis of COVID pneumonia. He was vaccinated before. But as I have said, he was vaccinated with Johnson & Johnson quite a few months ago, but again, severely overweight, diabetes, and hypertension patient. So this patient came to me when the diagnosis was made from the lab, and I have put him on the cortisone, as I keep on saying, we need to put them on that. I think he would not have got this ill. But unfortunately, so I would rather say this is a case that's been neglected because people think it is a mild disease. It is a mild disease, but you need to still to treat the disease.
Sure. Dr. Coetzee, some countries are mulling over circuit breaker lockdowns. India too has sent out a fresh set of guidelines. to the states talking about how night curfews must be imposed. I think all of us here in India are sort of getting ready for some restrictions in the beginning of the new year. Do you think that's a way to go forward, at least for a circuit breaker lockdown, and that is advisable? Has South Africa done something of that to that effect?
Okay, so South Africa, what we have done, we again enforce the masks to be wearing. We are asking people to stay away from big gatherings, and we are urging people to get their vaccines or booster shots. But the booster shots will start for the average public the beginning of January. So that's what we ask them. So we keep an eye on the developments and the numbers and the ICU cases. So at this stage, except for closing, especially indoor gatherings of like churches and those type of things, where there's a lot of people normally in a small space which is normally also not very good ventilated. We haven't done anything else because it's difficult. The virus is everywhere, and you just need to mitigate it. You need to use caution what you are doing. I'm always saying you need to use your common sense. And we're telling you the masks, we are telling you stay away from crowds, we are telling you get your vaccines. And that's what you need to do. Okay,
so any sort of night curfew or any restrictions vis-a-vis some sort of a lockdown, closing down of markets, that per se you're saying is not going to work in the case of Omicron?
It's already everywhere. That's why it's difficult. So what we have done, we do have a curfew. 11 o'clock at night, all the restaurants must be closed, and until 4 o'clock the next morning. So that we do have in place, and we do have in place restrictions on gatherings, but still, outside 2,000, inside indoors 750. It's still a lot of people. So that's something that we keep on saying, please, we need to look at that and maybe get less people, especially indoors. Yes. But more than that, South Africa hasn't done anything else. As we said, at some stage we need to learn how to live with this virus as well. And if our numbers are in hospital increasing, that your hospitals can't take the strain, that's when we will step in again. So for us, it goes about, can the healthcare facilities cope? As long as the healthcare facilities can cope, and the doctors, and we can protect our doctors, yes, we're not going to bring in any other curfews or any other restrictions.
Okay, that's a great point that you make, an important one, because there's a lot of panic here in India that the cases will surge and there will be lockdowns once again. But that's an important point that you make, that we have to eventually learn how to live with the virus. Dr. Coetzee, I'm not sure if you know, but I just want to tell you something, that in India, a sero survey that was done about a couple of months ago seemed to suggest that even amongst children and the adult population, the seropositivity was around 70%, 69% to be very precise with you. The government of India seems to suggest to an extent that they believe that Omicron is not going to have such an adverse impact on the Indian population because of high seropositivity rates. Do tell us, is that the experience with South Africa? Did you have seropositivity studies in South Africa, sero surveys there to suggest the impact of the Delta variant there, or vaccine-induced immunity, and then to see this, upsurge in cases courtesy Omicron?
Okay, first of all, there's anecdotal data or saying going around that between 70 and 75% of South Africa already have immunity.
Okay, so this was a sero survey, Dr. Coetzee? This was a sero survey that was done?
No. So it's anecdotal. There are studies done, but it's not under all population, the whole population done. So the few studies that has been done shows there's quite a huge seropositive antibodies out there, but it's not been done under the whole of the population. So it might be true that, let's say we have a 70%, and then if you compare it then with India, and yes, we have unfortunately only 40% or 44% of our adult population has been vaccinated. So if you look at that and you look at the mildness of these cases, the majority would easily if they get a viral infection, easily be treated. Then I think if you have more or less the same type of pattern that we have, then you should be on the same trajectory than South Africa. You will have a surge in your cases, and it's really going to climb, and everyone is going to panic when it climbs. But so it can climb. The question is the hospitals and the doctors, can they cope? And are the patients predominantly severely ill or mildly ill? That's what one needs. So in South Africa, the majority is mild ill.
Okay. Dr. Coetzee, there is a concern when it comes to cluster outbreaks. We're seeing quite a few in India already, and also household transmissions seems to be extremely high for Omicron. What's been your experience? Do tell us what's happening in South Africa.
Same experience. So if one in the family get Omicron, you can, and there's 7 people in the family, 6 out of 7 is definitely going to get it. And they're not going to get it all on the same day. They get it around about 3-4 days after each other. And again, it is mild. They just need to double check that they are okay. Go and see your healthcare worker, your doctor. And I'm not sure how other countries work. Make sure that your chronic diseases are controlled, and if necessary, start immediately with your prednisone. And then you should be fine. In the end of the day, your healthcare centers should not be overburdened.
Yes. Dr. Coetzee, you did talk about household transmission, and that seems to be high with Omicron. But I'm just going to talk to you a little more about what you're seeing in South Africa vis-a-vis children. Preliminary data in the presentations of South African doctors to the WHO seem to suggest that they were hospitalizing children, but they were also going back home quickly. Is that understanding, does that sort of analogy or does that sort of conclusion really stay right now, or have things changed? Is there any reason to believe that children will be worse affected because of Omicron? What are your findings? What is your understanding?
Exactly what has been said. So children always, especially in the beginning of any wave, will always be the first. They and the younger people. The older people come later in any wave. So yes, in the beginning, we saw the children, and a lot of these children that was admitted to hospital was not admitted predominantly for Omicron or for COVID. They were admitted for other reasons, and then coincidental found to have COVID. So these children, yes, the length of stay normally for Delta it would have been 2 weeks easily, 10 to 12 days. For these patients with Omicron, very, very mild, 3 to 4 days, and they've been discharged. So we also see that in the community, children not really very sick. They're sick the first 72 hours. They are sick, and then they're much better. They get over it.
Yes. So they are not becoming severely ill in that sense. What happened with the other variants like Delta, for example, is something that is expected with Omicron as well?
Yeah. Okay. They didn't get very severely ill. Even the pediatric ICU units are not at the stage full. So again, if we say it's a mild disease, we're not taking away the fact that you will be sick and you might have a fever, you might not feel well. What we try to say is it is not difficult to treat outside of a hospital. And most people should be treated easily at home without need for any hospitalization.
Okay.
But they need to go and see a doctor to make sure that they are okay.
Dr. Coetzee, a lot has been said here in India about how because the symptoms are so mild and they can be confused easily with the regular viral fever, that's the reason why, detection can be missed in the case of Omicron. And also I want to ask you a question about how the new symptoms, some doctors from South Africa seem to be suggesting that symptoms like lower back pain is being associated with Omicron cases right now. Is that correct?
That's correct. So that's the body aches and pain that we are talking about. So what this virus, the clinical picture is more of muscle and pain than of a blocked nose and a cough. You have to understand that. So it's the headaches, the sore body, the backache, the upper pain that you have in your thorax, the severe headache, my head is extremely sore, and I'm tired. That is the three most important things. So it's not I'm coughing and I've got fever and I can't smell. That's not Omicron. So Omicron starts with the muscle, the body, the bones and the muscle.
Yes.
That's the difference.
Okay. Dr. Coetzee, in India, there's a lot of clamor that we should have booster doses. Right now, we are touching about 60% of the population, the eligible population that is going to be doubly vaccinated, the 2 doses of the vaccine, and close to 90% of India's population has got the first dose of the vaccine. How important do you think it is for India to start booster doses, to start giving out booster doses, given the fact that there is no shortage of doses in India right now, there is no shortage of vaccines that India is facing?
So then you can. So it's important that everyone gets their 2 vaccines. Okay, the dosage, the proper dosage that's been prescribed by, some vaccines is 1 dose, most is 2 doses. You get your 2 doses. And then about 3 months later, in South Africa, we have seen that with Pfizer. You can take a bit longer with Johnson & Johnson, but normally if we look at boosters, it should be 3 months after your last vaccine.
Mm-hmm. There is some data that seems to be suggesting that an mRNA vaccine is going to work very well as a booster dose. In India right now, we have an inactivated vaccine and also a vaccine which is based on the adenovirus platform. So an mRNA vaccine as a booster is going to work the best for India. Do you agree with that?
We know that the mRNA boosters or vaccines works very well if especially if you had an adenoviral vaccine and then you use the booster of a heterologist,
Okay.
So that works normally very, very well. So it should work well, but it's going to depend on your scientists as to what they think is the best for your country. But yes, the studies are out there that it works.
Yes, fair enough. Dr. Coetzee, one last question to you. And this is a big talking point in India. Again, vaccines for children. There is the National Technical Advisory Group in India that advises the government on vaccination, on immunization. And there is an opinion within that group that children in India do not need vaccines just yet because the infection is mild. We have approved vaccines in India for children, but it's not been rolled out yet. What's your point of view?
Well, we do the same in South Africa. So if you look at 12 years and older, I think that those are the group that likes to go and party and go to their friends, and that's 12 years and older. I think it's the right way to try to get them vaccinated. Under 12, if you look at Pfizer's study that was just released recently, it seems not to be that much protective for young children. Mm-hmm. So I think, if you look at the cases and that, there's not an increase in death around children or a severe increase in hospitalization with the young children, then, I think one can still wait and see if there's better boosters or better vaccines coming on the market for children.
Okay. All right, Dr. Coetzee, thank you so much for joining us and sharing with us your experience, your perspective on the ground situation when it comes to handling the 5th variant of concern in South Africa. You've been at the hospitals dealing with patients, taking care of them. Thank you so much. Good luck to you.
Thank you so much, and please stay safe. And if you need your booster, go and get it.
Absolutely. Thank you. Thank you.
Thanks.
All right, you can find the entire interview and much more up on our website as well. That's indiatoday.in. You can also download the app. Much more news on the other side. Stay on with us.